Hi, I'm Joan Bulfer. I'm a health promotion specialist at Public Health, and I've been with the city for 30 years. Well, I started July of 1986, and I was hired to work as a nutritionist. I worked in the WIC program, and I also worked with the family health and the home care nurses. I did a lot of community work as well from the beginning. I worked a lot with the schools. Actually, at the beginning, I did a lot of classes in schools. I was often a guest lecturer to come in and teach kids about good nutrition. My job has changed a lot since in the last 30 years. I don't do very much individual or group type of education. In fact, we do very little nutrition education at this point. We are really looking at ways of dealing with helping the community change to be a healthier place by looking at bigger sustainable changes, and it tends to be population health versus individual health. The way you can make a much bigger change, and it has been a huge change in my field, is to focus more on the environment and making that a place where the healthier choices are abundant and appealing and hopefully reasonably cost, so that people find it's so much easier to make that healthy choice. A couple of years back, we started a healthy concessions initiative here in the city, and we were one of the first in the state to do that. So we were looking at all the city-owned concessions and trying to figure out a way to make the choices healthier. I really like working with our community partners. So much of the work that we do is with other organizations in the community. And so some of the really fun projects have been, I worked a lot with VEEP, so our local food shelf. I was very involved in helping them get from the ground up that whole idea of a commercial/teaching kitchen. It was pretty unique in the state. That kitchen has opened up the door to lots of things that they can do now with their clients and with the community, and that was just an amazing project to be part of. I've stayed here this long because I love my work. I love what I do, and I think that the health department has, over the years, I've been very fortunate. I've had a lot of freedom to kind of design my work, and as long as I could find money, because we're grant funded, I got to do it. And I've been able to do things that have been considered innovative and cutting edge, and we have great partners at the State Health Department who've also supported us doing that sort of work. And yeah, so it's been fun, and I enjoy it a lot.